Driving down this road for an hour, trying to get away.
It's so unfortunate that my partner Johnny could not be here. I'm sure he would have enjoyed you as well.
Okay. Well, I'm hoping he's on and
he's definitely online.
Us.
He's definitely online. He's joining us online, and definitely in the age of the COVID-19 coronavirus,
yeah.
we need to have these conversations.
Absolutely.
And we could not have chosen someone more appropriate to have this conversation with.
I'm honored and I'm humble. I have to say that. You could have chosen others, I'm sure.
I could have.
There's a plethora there's a plethora of individuals in the Haitian American community
Absolutely.
Who are well positioned and knowledgeable. But I thank you. I thank you for this invitation, and I thank you for your bond.
Yes, indeed.
And
I do enjoy the bond. Did you see the pictures that I posted?
I did. It was
of us.
We looked so great, and no filters.
Oh my God.
No filters.
None whatsoever. None whatsoever. You know what? Normally, women are very insecure around each other. You happen to be the one woman that I don't feel insecure around you, and
neither do I.
Neither do I. We feel very comfortable. We can be
connected.
very critical of each other. We can scold each other. Openly scold each other.
Don't do this.
Don't do this. Don't do that. Don't wear this.
Don't wear this.
You know, you need to lose a couple of inches here. And we went on our weight loss journey together.
We did.
Oh my God. By the way, happy Women Her Story Month.
Thank you.
That's another great reason why we have you here as well.
Thank you. Women's Her Story.
Celebrating women. And you are one that we really feel is worth being celebrated.
Oh my God.
For your contributions, your achievements.
Thank you.
Okay, what you mean to us as women, what you mean to the diaspora. I mean, for someone who's born here, you've done so much for Haiti. And Johnny, my partner, can tell you, one of the things that always really attract me to other sisters and brothers around the diaspora is their commitment to Haiti.
Yeah.
Because it's we have to put it on.
I'm excited.
So am I.
And yes, an American native, born in the United States, born in Brooklyn, a child of Haitian immigrants who came here to make a better way for themselves and their children. So somehow, some way along my journey within these decades, I connected to a country that my parents are from, but I was very, very, very far removed from. But there are so many opportunities to make a difference and to impact the lives of others. And so, before we begin, formally, I have a little gift for you.
Wow! Oh my God!
So I have a gift.
I did not expect this.
It's from, I want to say it's from me, but we're going to say it's from the Haitian American Nurses Association of Greater New York.
Oh my God!
I could think of nothing else to bring to you, so I want to give this to you.
Oh
and
my
I would love if you
God.
open it.
Wow! Listen, I got a heart condition, sister. You're not protecting my heart.
Bump. I want to give you a kiss, but you know, with COVID.
Wow. I've never had this done before.
Really?
Yeah, I've had plenty of guests on my show.
Have you had nurses?
You know what? You happen to be the first.
I'm the first nurse, and so this is how we roll.
This is how we class. This is how. Whoa, such class!
So
oh my
I'd
God!
love for you to open it.
Is it real muscatine?
It's not real muscatine.
Is it something Haitian?
Yes, it is.
Oh my God! It's Haitian.
It's not real muscatine.
Are you guys ready for this? Are you guys ready to share the joy of opening my gift live?
Please open it.
Oh my God! Whoa!
I could think of nothing better than 5-star rum
barbacoa.
Because I could not find a bottle of real muscatine this big. I said, what is the next best thing to help us during these times where we're on the inside and we want to keep nice and warm?
Can you imagine? One barbacoa, ladies and gentlemen. Jesus. Wow.
Just for you. Please
Thank
enjoy.
You.
One sip at a time.
Well, COVID or no COVID, you know what? We gotta. This is love. Wow. You know what? I think we need this, especially, let's hope we get the next 2 weeks off. Let's hope we get the next 14 days off. First of all, we're in this together. Mind you, every institution has closed their doors. I know at the college level, because we both work for CUNY, they've asked us to put our courses online, right? Our evening job is taken care of.
Correct.
The day job with the DOE, what's up with that, sis?
Yeah, so the DOE, unfortunately, you have to be politically correct.
Yes.
Unfortunately, they haven't, though parents are up in accolades, petitions are out, over hundreds and thousands of signatures, close DOE schools, close the schools. That hasn't happened.
It hasn't happened.
Is it going to happen? I don't know.
We're hoping that it does. We're hoping that it does, because otherwise our lives are being put at risk. And it's kind of, we're sending a double message.
We are sending a double message.
You know, places of 500 people or more
close down.
Close down.
But
yet
schools are open.
We're invaded with thousands of children.
Yeah.
I kind of feel like we're being babysitters for some reason.
Somehow, sometimes we are.
I don't mind. Yes. I'm going to keep it real. However, let's consider the health risks that are involved.
It's a double-edged sword, the way that I see it, because we serve millions of kids. Many of them come from less fortunate, economically stable families.
They do.
And they don't have the resources.
They don't.
So we close the schools. Where do they have breakfast?
Right.
We close the schools. Where do they have their lunch?
Yeah.
And some kids count on those meals.
Absolutely.
And then we close the schools. They don't have the infrastructure at home to support online learning. So, I mean, you have to be a pragmatist. You have to look at things, the big picture, where, I made a post today on my page, my Facebook page, and I listed, I think, the top 6 professionals who are at risk. And I kind of clumped teachers and educators into service workers. But we're just as much as risk.
We are. We're right in the front line, believe it or not. It's undeniably so. It is what it is.
Correct.
So,
but I feel like we're gonna make it through this. We're gonna make it through.
I'm hoping that we do. I'm hoping that we do. So, in the event that I have the next 2 weeks off, this is what's gonna keep us balanced.
Yes, and 9 months from now, I probably don't fall in this category anymore because of the
Are you gonna talk about corona babies?
But 9 months from now, I'm thinking there'll be tons of corona babies.
Absolutely. What do you expect people to do? I mean, they're off from work.
It's a time of
hubby's home.
Hubbies are home. Boyfriends are home. It's time.
Well, I don't fall in that category.
I want to say that I don't fall in that category anymore either. But it's something to keep in mind that during these times of quarantine and the streets are kind of empty, people are home making love.
Hey, to each his own.
To each his own.
I'm not mad at those people.
No, me neither.
I'm not mad at those people. Meanwhile, I'll continue to be in the me, myself, and I zone, which I really enjoy. Believe it or not, I do. I'm good. So, let's get into the meat of things. I mean, we've kind of informally started this conversation, and I'm hoping that my partner Johnny joins us. I'm gonna try to go on the computer here to be connected with him. But normally when we invite our guests, the first thing we like to do, as much as you and I are social media gurus, trust me, we live on social media.
We do.
I don't know, some people are scared of social media.
I know, I embrace it.
I embrace it. I mean, I think the messages that I've been putting out there are quite positive. I haven't had the need to feel insecure or feel threatened. I don't know, unless, but even with haters, I'm really worried about them.
No, we can't.
We can't.
You have to press on.
Yes, I'm pressing on. Pressing on.
Simply because you'll never find, everybody won't like you, and I learned that the hard way.
And it's all good.
And it's okay. You can't live your life based on that.
Absolutely.
So,
but what I was actually trying to get into is to introduce yourself to our audience, people who've seen you, maybe who haven't, people who don't. Who's Kelynne Edmond? I talk about you all the time. I make posts about you.
Yeah.
My most recent one was last night, of course. I praise you. We praise each other one-on-one. But sometimes people just see the picture.
Yeah.
They don't know the real Kelynne Edmond.
Yeah.
They might see, you know, a social butterfly.
Yeah.
I think that, because listen, I've had plenty of people give me their interpretation of who they think Mona Lisa is. Of course, like you, they're going to think I'm a social butterfly.
Yeah.
That's fine too. But I was shocked to have people walk up to me and say, oh, by the way, what do you do? Who do you work for? Really? You haven't identified me as an educator? Okay. So then, I don't know whose show I'm going to have to be on to say who I am, but luckily you get to be on our show today, so please tell our audience, who is Kelynne Edmond?
Wow.
And leave nothing behind.
I'll try to leave,
you know,
nothing
starting
out.
from your childhood, your education, you know, your life as you know, as a student, to get to your profession where you are. How did you come to that profession? Who is Kelynne? Who is
Okay,
this
I
wonderful woman
will try.
that who amazes me? Who, you know, again, I can't stop stalking.
It's a dual stalk.
It's a dual stalk. Okay, it's all good.
Well, who's Kelynne? As I mentioned earlier, informally, I am, of course, I'm a woman. I'm a friend. I'm a mother. I'm a sister. I play all those roles. I'm a lover. I'm a lover of life and all things good and positive. Parents are from Haiti, the North and the South. Somehow they got together and boop.
More specifically, when you say the North,
my dad is from Cap-Haïtien and my mom is from Okai.
Wow.
So they met in Deschapelles, where my mother was a nurse. Well, once a nurse is always a nurse, so my mom is a nurse.
Okay.
And that was eons ago because my mom is in her 80s and my dad is in his late 70s. And they instilled something in me that I think pushed me to be sitting right here today. They instilled the need for education. Now, many who know me, those who know me, know that that was not my first start, because though I did not come from an economically challenged family, my parents were very well to do. I had whatever I needed. I, as young people do, made the wrong choices and didn't go the traditional path. But thank goodness, thank God, thank the Almighty, somehow.
The wrong choices. Wait a minute. I'm saying, how could a successful woman like yourself say I made the wrong choices?
Oh, well, sometimes you have to, sometimes you travel a path where all the decisions that you make aren't the best, and hopefully you learn from them. And I can say that in my situation, I did learn from them. I was a teen mom. I had my first child very young. I mean, it is what it is. And then I had them back to back to back. And then I knew where I was from. I knew what my parents instilled within me, and I knew the kind of lifestyle that I wanted. And I made the wrong choices.
Wow.
I mean, I made a lot of wrong choices, but somehow with God's intervention, I was able to stand up, and there's some light that came on and say, hey, you don't belong here. Take your things and leave. This type of work is not for you. Gather your things and leave before you make a mistake that you will never be able to take back.
Wow.
So we all have skeletons in our closets.
Yes, indeed.
And I have, several. I don't plan on ever running for office. So hopefully they'll stay there. But for the most part, we do make, choices that are not usually in our benefit. But for some reason, again, I lean on the fact that I wanted to live a certain way. And there's no way when you're Black, economically challenged, that you can get there without the alphabet behind your name, which basically means you have to go to school.
Absolutely.
You have to educate yourself. You have to, commit to a lifelong journey of learning. And so that's what I did. My first choice was not nursing. It was human services and mental health.
Stop. Please stop.
That was not my first choice.
Listen to this. In 1986, when I graduated high school, trust me, I entered New York City Technical College into the nursing program.
What?
Yes, I started with liberal arts, transferred to nursing, left nursing, went into human services.
Wow.
So
and I did the opposite. I did the opposite. I went to, I don't remember the year because that would actually put a date on me. So maybe I don't remember it technically, but I enrolled in LaGuardia Community College to go into nursing originally. And I couldn't, yes, believe it or not, people, I couldn't make the grade to get into nursing school. And so my math instructor, who was also one of my advisors, who wasn't a nurse, said, listen, with these grades, you know, they start at 4.0. You're never going to get in there. Pick something else. So associate's degree was in human services and mental health. So I did that for a couple of years, and then I had a son. Many of you who know me intimately know his name was Akur, and he was born with some illnesses. He was not 100% at birth. And I spent a lot of time in the NICU at Brooklyn Hospital Center on DeKalb Avenue. So I want to shout out those nurses, many of them who are still there decades later in the NICU. They really, I was amazed by what I saw, and that it wasn't about just bedpans.
Wow.
It was about being knowledgeable. It was about knowing and recognizing by looking at someone, something is up. And it was about critical thinking. And then I said, you know what? I need to go back and become a nurse.
Wow.
So that was my catalyst. And then I went to, decided to undertake that journey at Long Island University School of Nursing, now the Harriet Rock Pop School of Nursing on DeKalb Avenue. I did my bachelor's there, I did my master's there, and somehow, divine intervention, along my many paths, I ended up there as an educator.
Wow.
My alma mater. So after spending some time at LIU teaching, I'm also a nurse practitioner. That's what my master's is in, adult and geriatric medicine. I still in practice. You have to find a way to maintain your skills, and so sometimes that means my days are about 18 hours long. Because I teach.
I could imagine.
And I'm a clinician, and you've got to stay connected in order to know really what you're talking about. I believe in research. I'm a doctoral student.
Shout out to you.
I'm hoping.
Shout out to you.
In the next couple of years,
you'll be Dr. K.
Dr. K.
Dr. K.
We'll be having a different conversation.
I'm calling you Dr. K because you call me Doc Mo, and I have a friend who I was sharing this joke with. I said, you know what my friend calls me? She calls me Doc Mo. I said, that he thinks that is so cute.
I love it. I love it.
So we'll be calling each other.
We'll be yes.
I am looking so forward to
that. I am
too. I am so looking forward to it. I can't wait.
It is.
It's long overdue.
It's long overdue.
Long overdue.
It's an enlightening experience.
Indeed,
you learn so much, and the idea is to take what you learn and use it to impact someone's life.
Yes, indeed.
So, I mean, at the end of the day, despite where I've been, where I was...
Listen, all of that matters no more.
Yeah,
seriously.
We're here now.
On dit en français, en toute chose, il faut considérer la fin. So meaning, listen, whatever your past is, no one is perfect.
No one is.
None of us are. If anyone claims to be perfect, I would call you the biggest liar. But today, the woman that you are, what you represent to your community, to your family, and I'm quite sure your parents are proud of you.
Yeah.
But let me ask you this one question. Having been born from Haitian parents, what were your parents like? I mean, because this is the saying for Haitian parents is 3 L's. You know what the 3 L's are? L'église, l'école, la caille. So how did you escape from the 3 L's?
Well, that was my first big mistake. I left la caille at an early age because I couldn't do these 3 L's. I felt pressured.
Another rebel.
I was a rebel, and my parents were like, the police, the Haitian police.
Listen, Haitian parents, girl. But how did that shape you as a parent? Now, when you became a parent, were you thinking, wait a minute, am I going to get a taste of my own remedy? How were you raising your son? Because I know it's not easy to raise boys in this country.
No, it's not.
Because I have a son. Luckily, he kind of adhered to, the 3 L's. And I don't know if you watched one of our recent shows where he was talking about, hey, having grown up from a Haitian mother, what did you expect? I'm the person that I am today thanks to my mom, because she would not take no for an answer. If she says it, you better do it or else.
That's a very unique, that's a wonderful question. How did my rearing affect, I think I had become my mother. So by default, I had become my mother, which is what I tried to do, the 3 L's. And then when these guys, these men they are now, except for my 12-year-old, started to experience, breaking away, these 3 L's it wasn't working.
Wow.
It wasn't working, so I had to become a little bit more open and less restrictive. And I think that I had an aha moment when I think my number, I call them by numbers. My number 2 did something and I wanted to scold him. Oh no, it was my number 3, Alex, and he's like 201 pounds, 6'2", I believe. And I wanted to scold him, and I kind of believed in corporal punishment. Yes, I do. And he looked at me. He says, "No, you're not." He didn't grab anything. He didn't, He just said, "No, you're not."
No, you're not.
And that was my aha.
And you had to stand there and say, "Huh? What did he say? What?"
Yeah. And,
did you say?
And then at that point, I'm like, I have to find a different strategy. So I think it worked in the beginning, but we have to learn, as Haitian parents or Haitian American parents, we have to learn to be flexible. And we have to allow our kids to find their identity while still providing them with structure. I've been blessed. I mean, it's a blessing. It's a requirement for your kids to graduate high school. So I don't go, I have a high school graduate. When they start doing things like coming out of college and having their bachelor's degree, that's when I celebrate.
Of course, and I'm in the same position, of course. I'm definitely in the same position because between my first 2, they're 10 years apart. My son is 31, my daughter's 21, and when she graduated high school, she graduated with honors. She was very advanced. I was very proud, but guess what? There was no celebration.
That's it. That's the
because I'm like, girl, it's only high school. You need to do the college thing.
That's it.
Then that's what I'm going to celebrate.
We will have a celebration.
And of course, I don't know how your kids feel, but when it comes to my kids, it's like, whoa, it's hard to be Mona Lisa's child because it's so demanding being my child. I mean, not because I'm in education, but because of my life as a child also, because I had a rough life. I mean, I always tell people, and I'm not ashamed to say it, growing up in Haiti, life was not easy.
No, I can imagine.
I mean, I'm looking at our kids, how blessed they are, how much they have available, how many things they have at their disposal. Life is easy. It's like LG every day for them. But I didn't have it like that. I had a very rough childhood. But until I came here, even coming up here at 13, it was still rough because coming up here as a new immigrant, the challenges of not speaking the language, having kids bully you, making fun of you. But I can proudly say, listen, all of that was a learning experience for me. It made me and shaped me to be the woman that I am today. So, when you would go to my house, you'd see, I put my little papers up. I tell my kids, look, you see all of this? You better get that and more.
That's it.
So that kind of, Ma, you were a nerd. All you did was stay in school.
Yeah.
Well, who in like this all for what? You don't need that. If I can make it with just a bachelor's or a master's, I'm good. I'm not going beyond that. You're just in there doing 1, 2, 3. No, we're not doing that, Mom.
Yeah.
And that's how I kids feel. That's okay too.
That's okay.
I don't try to choose their careers.
That's okay.
But I'm looking at you though with your kids. How do they feel about you having accomplished everything you've, despite the challenges that you have?
They're proud. I think
I'm
they're
sure
proud.
they are.
They're really proud. I only hope to model behaviors Because when you reach a certain level, all eyes are on you. Not just your kids, but your friends' kids, or the kids or adults in your class. I had recently, I gave a group of my students a project to do on Women's Her Story Month, and they went on Google and they Googled my name. And when I came into my room, I had a picture on the board, and they were like, "Oh, I'm gonna pick." One of them said, "We want to pick you for Women's History. We'll do you as just share us some information about you." And I said, I was like, "Wow, this is great. I'm humbled. However, I haven't done anything yet."
Wow.
I'm like, they were like, "No,
I choose you too. I'm trying to get an A. I'll pick my professor."
And they said, "Oh no, you're the president of the Haitian American Nurse. You're president of a nursing organization. You teach. You've been to Haiti. You've done all these things." I said, "Yes, but I'm still building what it is my legacy."
I mean, you're a college professor. That's like a huge accomplishment.
I mean, but I haven't done much yet. Right now, I'm standing on the shoulders of those who came before me. And as it relates to the whole nursing and the nursing organization, I'm standing on Marie-Edline Hippolyte's shoulder.
Kudos to Marie-Edline Hippolyte. I hope she's watching.
I'm standing on Michelle Saint-Élien's shoulders.
Kudos to Michelle.
I have goosebumps while I'm saying it.
I know.
I'm standing on Betsy Pierre-Louis' shoulders, they had a vision in 2010 after the earthquake in Haiti. How can they mobilize people to go down and help? And then some years later, our immediate past president, Marie-Hippolyte, came and took the reign for not 2 years, not 3 years, but for 5 years.
That was a long
And she
time.
laid the network down for this organization that I am the lead on right now. And so those are the people whose shoulders that I stand upon. And those are some tough shoes to fill.
Oh, I know. I could imagine.
Yeah,
I could imagine.
When Marie IPP Hippolyte left, I was extremely saddened.
Were you scared? I was, because I do remember the transition, because you do know that, and I'm sure during that transition, you saw how she and I collaborated, because she and I traveled to Washington together, at the UN together, wherever there was a conference, if I'm there, we collaborate so well, and I would invite her, and she would always respond to the call, just like you, and I'm glad to see that you're following the same path.
I'm trying, it's very hard.
And she was very humble, as strong of, listen, it's funny how,
she's tiny.
I mean, I'm short too.
She's tiny.
But she was a strong woman.
She was
very strong woman. I mean, in terms of the leadership, you got to give it to her.
Yeah,
you got to give it to her.
Some of the very leadership strategies that I've learned. We have a very our relationship is strange, because not strange, but I first met Marie at Long Island University. She was my graduate student.
Wow.
So she was completing her hours and working under me at LIU. I was the director of clinical laboratory resources.
I remember those days. I remember your little fancy office at LIU. I remember that.
And so that was our relationship. And she just kept talking about this, Hannah, I'm going to invite you one day. You have to come. And I'm just hearing it's Hannah stuff. And then a year or two after that, she invited me, and I came, and I became a member, and I worked very closely with her to learn about.
I saw that. I noticed. Trust
the organization.
Me. Yes, you embraced the mission. You embraced the vision so quickly. I was shocked, because before I knew it, you were tagging along. You were putting your hands in everything. Yeah, I remember during one of the conferences at LIU, how deeply involved you were. Yeah. It's like it didn't take you long to.
No, it didn't. And she I think she had her eye on me, and she would mold me. She was not wood, she molded me.
Yes.
And anything that I did that was out of character or did not embrace, because I like to have a good time. People who know me know that. I'm a social butterfly, but at the same time, I'm very reserved. and some people may say, "Oh my God, I expected more from her." She's very quiet in person.
Yeah.
And I am at the same time. But when and I don't drink, and it doesn't take much for me to kind of loosen up. But she would, if I did anything that didn't embrace our core values, she would pull me aside.
And that's a true leader. That's a true leader. Rather than going behind your back and talk nonsense and sabotage you and mess up your character, it's best to call you to the side and say, you know what, sis, you should straighten up. And listen, I'm going to say this to you guys live. If I'm ever falling out of character, please don't be afraid of approaching me. Inbox me, text me if you're my friend, email me, let me know, because I'm not perfect. Right?
Yeah. No, nobody's perfect.
None of us are perfect. And then you said something earlier to the fact that, I'll never run for office. Listen, our politicians are not perfect either.
Yeah.
They got skeletons.
No, you're right. Yeah, everybody has skeletons in their closet. Yeah.
And I'm quite sure, if it's meant for you to do, if it's in the master's plan, the master's plan for you, it's just gonna happen.
It'll happen.
It's just gonna happen. Okay.
So that being said, I let them know that I still have quite some work to do. So go and find a black woman who really made an impact. I'm still trying to commit to causes, find causes, help others, and in all essence, really truly to be kind. And that's huge, I think.
It's funny how I tapped into the philanthropic side of you. I didn't expect you would be so receptive to donating. And I know on a lot of projects that I've done, you're like number one on my list that I would call without giving me a headache. You'll be like, all right, Mona Lisa, I got this. The check is in the mail. And it's not coming from the organization's pocket, it's coming out of your own pocket.
Yeah.
And you never think twice, anything for our young people in the community, because I've done quite a few activities for the young people, and you've always been one of my biggest contributors. And I want to publicly thank you for that.
I mean, it's about supporting one another. So for those of you who don't know the Asian American Nurses Association of Greater New York, we're going on our 10th year. This is 10 years. 10 years in the making. We don't have money. The little money that we have, comes from sponsors, wonderful donors. Many of you, I'm hoping, are watching. They come from our members. Our members really rock. We're a small group. We hope to one day become a mass. So that means a lot of times when I find something that really, says, wow, this is a great cause, it means going into my own pocket. Thanks to the grand architect, I'm in a position where I can go into my pocket several times a year, just so that our organization doesn't, carry that brunt. Is that a smart business? Does that make business sense? Probably not. But let's keep it real. We still have work to do, and we need to be able to tap in those funds to get the work done. So it's about supporting one another and being present. If Marie hasn't taught me anything, it's you're not present enough. You need to be out there.
Yes.
Why was this, and this is still happening now, why did this happen and I didn't see you there? And so I'm usually like, I'm not sure. I really didn't know about it. Some things I see going on, I'm like, wait, why didn't I get an invitation? Or maybe I didn't go through my emails.
Well,
maybe
listen,
it was there.
By now you should be tired of me because I definitely keep you in the loop.
You do keep me in the loop.
And you're receptive.
And I'm receptive.
Yes.
For those of you out there, I am the face of the Haitian American Nurses Association for the Greater New York area. We have about, and somebody can correct me if I'm wrong, because I'm sure we have some of our members watching, about 11 different Hannahs, all from stemming from the one great Hannah. I want to say the one great Hannah, but the organization that's been around for the longest, and that's Haitian American Nurses Association of Florida.
Yes.
They are
Who's
amazing.
The president? Is it Marjorie?
No. Pauline, I don't want to say her last name, Majist. Please, I hope I said it correctly. She's the president right now. Marsha Ilwa is the immediate past president.
I remember Marsha.
And everybody knows Dr. Etienne.
Of course.
Dr. Etienne. She is our...
Very outspoken.
She is very outspoken,
yes.
very present.
Very energetic.
Very energetic. And she's kind of that rock, that force that kind of keeps us... She really does her best to keep that network together, like a mesh, to keep all the pieces of the net together. And for their leadership,
I love Dr. Etienne.
She's amazing.
Yes,
she really is amazing.
I love Marjorie too. Marjorie Lozama, believe it or not, she's quiet storm.
She is.
She's quiet storm.
She is now the chair of international affairs for Hannah, Florida. I don't know anybody else that would have done the most eloquent and bang up job such as she is doing right now. And kudos to Hannah, Florida.
While we're saying kudos to the Hannah sisters, allow me to send a special kudos to Maggie Hippolyte one more time. Again, who is my number one connector, who really got me connected with all the different sisters, across the states. And I also want to send a special shout out to Mireille Leroy, IPP of Hannah of Rockland County. No, it's not Rockland County anymore.
It's Hudson Valley.
Hudson Valley.
Hudson Valley.
Also IPP sites, Bibian Dimash sites.
Yes.
These are all my homegirls.
Yes,
we hang out together a whole lot. Always on the road. Always in Haiti together. That's the other thing that kind of create a stronger bond. I have to also thank them for the level of collaboration that they had after Hurricane Matthews took place. It's funny how these women, and I'm saying this with goosebumps all over my body, when they share their stories and when you witness the type of work that they do on the ground, it is, there is nothing that any one of us can say that would sound grateful for their hard work, their dedication, their selflessness. Imagine them getting on a plane that doesn't have seats. Yes, they get on these planes that don't have any type of fancy seats. They sit on the floor with their luggage, with their little bag. After the earthquake, when this earthquake hit Haiti, I'm telling you, they were the first responders on the ground, and the challenges that they took to get there, with no water, no time to take a shower. When they share their testimonies with you, it's like
it's moving.
It's moving. Really it's moving for me to be able to share meals and share conversation with people like this. It's like I don't even know how to express the level of gratitude that I have on behalf of Haiti, who today continues to be in a state of need, a state of SOS, a state of emergency.
Yeah, it is.
But they're always there. Yeah. These women are always there. So Mireille Leroy, kudos to you. IPP Poli, thank you for the work that you've done. Bibian Dimash Sykes, all of you ladies, Marjorie Lozama, I cannot thank you ladies enough for being so selfless. And to you, who's assuming the presidency now, and who wholeheartedly have embraced it, and humbly so too. You know what? When I first saw you, I never thought you were this humble.
Oh, I'm humble.
That's one other thing that really amazes me about you. It's your level of humility.
Yeah, I'm humble.
Women are pretty, they're gorgeous.
Oh, thank you.
They feel like you gotta roll out the red carpet for them.
No, that's not me.
And you have to kiss up to them. You have to bow before them.
Never that.
And if you're a Zuzu, trust me, I don't do Zuzu.
I'm not a Zuzu.
As much as people may think that you and I are both Zuzu, I'm not. Because when it's time to get the work done,
we get the work done. I'm humble. I'm very approachable. For those who don't know, I'm like totally receptive. Mm-hmm. I'm open to criticism. I'm always looking, because I'm not perfect. And no one is perfect. Mm-hmm. I'm always looking for ways to be better, to do better. And I've taken on another 2 years in the presidency role of the organization. And I've learned a lot. I've learned that in my humble manners, sometimes I used to get very excited. Like if somebody said something, I was quick with a response. I've learned to sit back, let it marinate.
Digest it. Yeah.
Let it marinate. Yeah. Think about my response. Meditate on what I should say, rehearse.
Yes.
You know, sometimes. And I've come to a level of understanding that not everything deserves a response.
Absolutely.
I think that's really a challenge when you're in a role of leadership, where everybody's waiting for you to say something or say nothing.
Yes.
And by saying nothing, you say something.
Of course.
You know what I mean?
And I think I've been in that position a lot where people probably expected me to get very emotional about the situation, and I just kind of sit back.
Let it simmer.
Let it simmer.
Yeah, let it simmer.
Yeah. And I don't always have to be in the forefront.
No, you don't.
Somebody else can take the
Yes.
space.
Yeah, and I see that about you.
Yeah.
I see that about you.
Yeah.
You're always pushing.
People don't have that impression though, but I'm always, I do a lot of background work, behind the scene work, and I enjoy it. Yeah.
Pushing leaders forward,
Yes.
which is amazing. Which is what we need to do as a Haitian community.
Yes.
Which is what is lacking. So I think that's really amazing.
I think I'm proud of our most recent visit to Washington, where last Sunday at this time, I was already in DC, advocating and trying to, and the background work that was done for us to get there. I want to say kudos to HRA, the Haiti Renewal Alliance, who
Chapeau bas.
Chapeau bas, yes,
Chapeau bas.
who continues, Magali Backer and her husband Furman, who day in and day out are always thinking about the diaspora, always thinking about Haiti. And
Always thinking about Hannah.
always thinking.
Thank you.
Well, you know what this whole relationship started with
tell me.
Hannah. Well, this whole relationship with Hannah went back from with Hurricane Matthews. But even prior to that, your past president, Marie Hippolyte, of course, every time I was going to DC, she always came along with me. I was chair of the gala at NHP at Howard University, and you were there at that table. You were there. That was 2016.
Yes,
right.
Yeah.
So I remember it was that same year that Hurricane Matthews happened, and that morning of Hurricane Matthews, Mireille called me, and we got on the phone with Lulu. We said, "What are we doing? Haiti needs us. There's a crisis," and we started a chain of conference call.
I remember
with Mireille, myself, Lena. All of us, started conversating. But before we know it, we say, what? Why don't we connect to DC, and where we can have a greater impact? So Furman and Magli and Albert DKE, who is an attorney with the United Front for the Haitian Diaspora, we decided to join them on that fight. And from then, that relationship has blossomed, and it really has strengthened. And Hannah has become part of every dialogue, every conversation that we've had thus far. And of course, recently when this whole conference was being put together with HRA, and Margaret said, listen, Lisa, I need to try to get, our health professionals out there, get all these organizations. So who would you suggest to be on the panel? Of course, your name came first.
Yeah, that was amazing.
Yes, I don't know if you recall, we got on the phone that
you texted me.
I texted you.
You did, and I said, oh.
Actually, I did a joint text between.
Yeah, I saw this other number. I'm like, who's
yes.
I know this is Mona's number.
Yes.
I said, oh, something's cooking. And you put us together. Thank you for that.
Indeed.
Unfortunately, because of my teaching
constraints
and the constraints of my schedule, I could not make it to all this consecutive days. But advocacy is the underpinning of what you do for those who are vulnerable and can't advocate for themselves.
Indeed.
It was, and I'm hoping that we can build on this momentum. It was amazing to be able,
certainly was,
to be even in the presence of that audience during that panel, to even have the ear of MSPP, even to have the ears of MSPP, who was there with his entourage, was significant because they can hear, they'll hear, the outpours, what's needed. And many organizations, they don't tap into MSPP. They come in with their own resources to make a difference.
Absolutely.
And it's a life-altering event or when you have the opportunity to come to the table at that level. It is amazing, and so I do thank you for making that connection. And we are open and receptive to doing whatever we can to serve our people, and our people are we're everywhere.
We are
everywhere.
It was quite overwhelming, I would say, for the first 2 days, between Cozy Joseph, who is the president of the GCF, which is Gascon Clergy Foundation. I wanted,
Cozy.
yes, I do love.
I really love.
Oh my God, Cozy,
yes, always has a smile on her face.
Yes, she does. Yes, indeed.
She's just amazing, and the work they're doing is it's heartwarming.
Indeed.
And it's not just about doing a mission and coming back next year.
No,
they are providing consistency and continuity.
Besides the consistency, but it's the transparency.
Yeah,
that's even more amazing, because they have all of their reports online. They have, they dollar for dollar, penny for penny, what they do with the money that they collect from the fundraising, activities that they do. The medical mission, the educational mission, all of their work in Haiti is everything is transparent.
Yes,
and the transformation that they were able to, accomplish in Lekai is amazing. It's amazing. I don't know what that whole south of Haiti would have done without them.
Yeah.
Yes,
it's I don't know.
And their collaboration with Capra Care as well is something that is also worth celebrating. But I'm still in awe at the amount of work that we were able to do within 3 days of being there. I mean, a shout out to Felicia Ross. Oh my God, my other partner in crime. It's like we all became attached at the hips between Felicia and Cozy. We were tagging along everywhere. We went into, the Congress people's office. We went, Yvette Clark, Hakeem Jeffries. We went into all their offices to lobby and really put in our pleas, what we want, what we're expecting, what we need, especially with this malaria that's an issue. Around the world, it affects the entire globe.
It does.
And I don't have to be a nurse to be doing the advocacy work. I think my voice counts. All of our voices count.
Our voices count.
And we all need to be out there doing this kind of work.
Talk about count. The census.
Yes, we're gonna get into the census. But before, our two things that we can't leave out of this conversation today is COVID-19 and the census, and how it's like simultaneously they're both happening now. And how do we respond as professionals? How do we take people away from the level of panic that we're having with our population right now? So definitely, when do we get started with that?
I don't.
What is corona? What is that coronavirus?
Well,
everyone have their own formulating their own opinions of what they think it is.
I mean, there's a lot of conspiracy theories about the coronavirus. It was created for mass population control. I've heard just about so many different things, and from people who are seemingly well educated.
Unfortunately, so.
But at the end of the day, it's here. There is a lot of panic around it. People are taking advantage of it by raising prices on hand sanitizer. There's a lack of toilet tissue, which I'm not sure what the connection is between the coronavirus and Charmin's.
I'm still trying to understand.
We don't know. We're trying to figure that out. So that's some research to be done down the line after all of this hysteria. But is there a reason to be concerned? I think that concern is valid, and I think that any town, any orders that have been put in place to quarantine, they come with some merit. But know that not everybody falls in the same risk category.
Okay, so how do people contract the virus?
Well, it's a contact. It's not so much. It's not an airborne thing. So I see people walking around with masks. I know where I am. I work in the evenings at one of the NYP campuses, and we are at the hysteria over gloves, not so much gloves, but the masks. Because people are just taking them. Visitors come in and they just take them, thinking that it would provide them with some protection. Even today, in my general Sunday routine with the boys outside, I'm seeing people with custom masks, surgical masks, the particle N95 mask, if there are any healthcare providers. You don't even need to be a healthcare provider. The mask that people wear to prevent tuberculosis. So I see people on the streets wearing that. So the only person who really should be in a mask is the person who has COVID-19, so that they don't spread. I went into a T-Mobile, or was it a Metro PCS today, to get my son a case for his phone. He just celebrated a birthday. Hey, AJ. He's 13, and I got him he has a nice phone, and so I went to get him a case, because kids, they drop things, they break it, it costs $100 to fix the screen. And the store was empty, and every employee in the store was wearing gloves, vinyl gloves.
Well, I'm not gonna lie to you. I've been going to school, going to work, wearing gloves. So am I ignorant for doing that?
I mean, there's a level of naivety in that. There is, I'm sorry to say, yes.
I gotta protect myself.
You do have to protect yourself. However, the best way to protect yourself is washing your hands, at least for 20 seconds, using soap and water and a lot of friction. This is ABCs of healthcare, nursing, whatever you want to call it. Using some hand sanitizer. I have some in my pocket I walk with. I have it in my pocket back here. It doesn't really belong there, but it's there.
Wow.
Using hand sanitizer. Coughing and covering your mouth. And not covering your mouth with your hands, which you're going to go touch everybody with, but go into a sleeve or cough into some tissue paper. Also, I'm walking around with tissue paper.
Yeah, but you see, it is that same person that's supposed to be doing that I'm not sure if they have it or not. Because of that person, I'm wearing my gloves, I'm wearing my mask, so I don't have to breathe that.
But think about it for a minute. So you're wearing, technically, when we wear gloves, as whatever industry you are, because it's not just healthcare professionals that wear gloves, the people who are cleaning the plane in between flights, they have to put gloves on. So technically, every time you wear a glove and you use it, you're supposed to take it off, wash your hand, and put a new one on. So if you're standing in the Metro PCS store waiting for customers, touching everything, and you have gloves on, interacting with people, taking their money, touching people's phones, you're actually moving your gloved, contaminated hands to someone else who's not contaminated. And
Wow.
you're really spreading this stuff. So we need to really relax, take a deep breath. If you are a certain age, if you're elderly, not even if you're elderly, if you have some comorbidities, health problems such as heart disease, COPD, asthma, you're a diabetic, you're more at risk for developing, the flu. So the idea is the same. You're still at risk for developing, if you come in contact with somebody who's infected, you're more at risk. So avoid large crowds. Like, as you know, a lot of events this weekend
have been canceled.
Oh. And I was so looking forward to a wonderful Saturday gala last night, and that was canceled, to be postponed, not so much canceled. I Am Ashe's event postponed. Heal Hades, Ambiance Lakai, postponed. But I would expect no less from educated health professionals. Because if we gather together, even in celebration, all it takes is one person to spread this.
Explain to me why the fact that the individual from upstate New York, from Rockland County, who contracted this virus, they literally had to retrace his steps to see, okay, if he went to Grand Central, is it the media that's amplifying things?
I mean,
why are people in such a state of panic?
Because it's real. It's real. People are in a state of panic because it's real. Does the media amplify things? There wouldn't be the media if they didn't amplify things. However, you know, I'm not an epidemiologist, and I don't claim to be. But I'm a nurse practitioner, I'm a nurse educator, and there's some basics that you know, that infections spread.
How has that changed your classroom practices? Seriously, I'm quite sure your students are coming into the classroom saying, Professor, hey, listen, I'm really worried. Like, even, I mean, the simplest things that they could have dealt with on their own, I'm sure they're relying on you now as the expert, as their professor, to enlighten them. And how do you manage to maintain your composure as everyone else in your classroom is in a state of panic?
Correct. So how has that changed my practice? It's changed a little bit because, somebody just said that there's an event that was canceled. I don't know, you probably know this person. Jean-Chris Romulo.
Yes, indeed. Yes, he's from Hill, Haiti. Yeah. Yes, Jean, we got you. Yes.
Hello, Rodney's, president of Halani, Haitian American Lawyers Association.
Yes.
Thank you for being on. Thank you so much. We're so happy that you've tuned in. So how has that changed my practice? First and foremost, lots of people are not coming to class. As you know, City University of New York and SUNY has moved everything online. Clinical rotations have been canceled. So I also work with the Department of Education as a career and technical educator in a school that many should be familiar with, Clara Barton High School. And that's a huge change in the pedagogy for me.
Of course.
Because going from teaching, going from the Knowles theory to the theory of no longer teaching adults but teaching children is children who think they're adults, is totally different. And so now it's like I have this clinical group of students. It's about 13 of them together. And 1 week we're in clinical is 7, and the other week we're in clinical is 6. I kind of have to treat these children, because they're minors, like my kids, right? So when we get onto the unit, they have a level of understanding and education, but I have to keep in mind that they're minors, like not letting them go into certain rooms, if somebody's on isolation precautions. Because I'm thinking, if this was my son or daughter who's not even 18 yet, but who's studying to be a nurse's aide, or to have that certification, or LPN, would I want him or her exposed to somebody who has something like MRSA or even VRE? So we show up in our dandies to the nursing home, and we see a big, and I won't say the nursing home, but it's in Brooklyn, and most nursing homes have adopted this because of CMS recommendation. There's a sign on the door, no visitors at this time, and they quote COVID-19. So I go into the building and I'm contemplating, like, what do I do with my students? We're not visitors. We are here, the students are here to learn, but at the same time, they're minors. Like, what do I do? So I see the executive director come in to check my temperature, because that's what CMS recommends.
Yes, indeed.
Everybody, you're visiting somebody in a nursing home, all visitors, or even employees, they stop and check your temperature. And if it's greater than 101, I believe, or 100, don't quote me, please, they're not allowed to work. You get sent back home. And so I said to him, there's no need. You don't need to check my temperature. I don't think right now is the time for us to have our students here. And he looked at me, he says, I agree.
I agree too.
I totally agree.
I definitely agree.
So I waited to my ducklings, I call them. I said, when I'm on the unit and you're done, you follow me around like ducklings, because they're not even 18. And so there's an added level of responsibility for me as an educator, because now I have people's kids.
Yes.
And pound for pound, the healthcare profession is more female than male. Nursing, though I embrace and I want males to come into the profession, there are more females than males. So I tell them, I walk on the unit, when you're done, you follow me around. And so it becomes a little bit of hysteria when the nurses' aides are wearing masks and the students are not. So the students are like, why can't we wear a mask?
Yeah.
And I said, well, you got your flu vaccine, right? Yeah. You're not sick? No. I said, then there's no need for you to wear a mask. It's all about washing your hands. And
you know what? It's funny. I was in New Jersey yesterday. I went to visit a relative at an hospice.
Did they have signs up?
They had the big signs up, and I'm walking in, and the lady's saying, "Oh, stop!" I said, "Okay." She said, "I have a couple of questions to ask you." So I had to be interviewed. They had to screen me to make sure that I was eligible to go in.
What kind of questions did they ask?
Well, she says, was I out of the country recently? Have I been vaccinated? Have I been practicing, safety, precautions? And have I been washing my hands? I said, yeah. She says, well, I would advise that you go wash your hands again before you go and see your relative. I said, okay, no problem. I understand. You're doing your job. You have to protect your patients in here. So I wasn't offended.
Huge.
But
it's huge.
Which
it's
is
impacting our lives.
Now you can understand why I was asking the question, and which is why also as an educator, we both work for the New York City public school systems. We're trying to wonder why haven't the mayor closed down the schools?
But I mean, like we talked about before, it's not that simple. I mean, you think I agree. As a
is it a nasty question?
No, it's not. It's not a nasty.
It's not a nasty question, right?
Not at all. It's a real question, and what are we waiting for? That's But again, this question has so many layers.
A lot of layers.
Because it's going to impact transportation. It's going to impact DOT. It's going to impact parents. Many of us are somewhat babysitters.
Yes.
Especially when we look at the elementary school system.
Whether we like it or not.
Like, it's going to impact where am I going to get money to pay for childcare? My kid can't go to school. The mayor is saying, oh, if we close the schools down, teenagers will be on the streets. But guess what? Teenagers are on the streets right now.
What do they do during the summer?
Teenagers are on the streets.
What do they do during the summer?
On the weekend.
What do they do on the weekends?
I mean, it's not as simple as just closing the schools. I understand that there's some ramification because it's a double-edged sword. Mm-hmm. But we're waiting. I mean, after-school programs have been extracurricular activities canceled. No after-school programs. My son goes to this Saturday school thing that they do for enrichment. That was canceled. So in some ways, they're doing some sort of quasi-form of canceling. My attendance in most of my classes has been very poor because people who can afford not to send their kids to school aren't sending their children to school. Mm-hmm. Are we sending ours? I have a 12-year-old who just turned 13. I send them. I also arm him with hand sanitizer. I tell them to wash your hands. That's really what it's about. And he's nervous. He's nervous because a great example, one of the older brothers wanted to take him to the movies. And he says, I don't think right now is the time to be going to the movies. And so when I heard him say that, I turned around and I said, well, why would you say that? He was like, Corona? Like, Corona, Ma, Corona? I'm like, okay, that's valid, but I'm sure many people are thinking the same thing, and that theater is going to be empty.
Now let's look at the political aspect of this whole Corona situation, where the president recently was asked publicly, and he thought that was a nasty question.
Wow, I mean, I'm not into politics. I mean, I leave politics to the politicians. However, when I heard that, I was dismayed, but not shocked, because this is who's leading our world, our country, and this is the level of ignorance that is there. CDC in itself has faced major cuts under this sitting president. There are areas specific to the study of what's happening now that has lost funding. and that has lost actual offices or departments, and that relates to manpower. So we're at a disadvantage. I don't think that was a nasty question. I think that
Neither did I.
I think that's a question that taxpayers, that human beings who live in the United States of America, this free country, deserved an answer to.
So with that being said, so the purpose for my question was, okay, is that calling for citizens like yourselves, taxpayers like ourselves, do we have the right to not just question, but mobilize around this issue and see how we can get results for our communities?
It is our
Whose job is it?
It is our civic duty.
Exactly.
And it is our duty to reach out to our local politicians. It is our responsibility to mobilize. And I mean, if you think about it, there was SARS, there was Ebola, I might be missing one or two, and now here we are at the Corona. We've made it through those. We'll make it through this, but we need to mobilize and bring ourselves together.
You're saying we will make it through this. How long are you expecting this to last? Because
I mean,
we're sitting here thinking,
you know what I'm thinking? I'm thinking I might be ignorant, and you can call me, you can say it if you please. I'm thinking right now we're riding the wave, and eventually this is going to die down. Because
yeah, but when do we get to the slope, and then where this whole situation is going down?
I really don't know. Because right now we need resources, testing kits, so that we know what we're dealing with. Because there are shortages.
We don't have shortages.
Right now we know that there's a virus, and for most viruses there are no cures. There's no cure for the influenza virus. Where there's Tamiflu, but that's more symptomatic. So I mean, we're in a tight predicament.
Yes, because as a healthcare professional, I'm quite sure you're concerned about the lack of resources available, the lack of kits available to test the population, and then now in the midst of all this, we're trying to get census. So how
is huge
that already without Corona, the census had challenges in itself.
Yes.
Now with this, that makes it.
It makes it even more, and the timing could not be, worse.
So how do we now portray this message in a way for people to kind of understand what's going on and not act ignorant, and still understand the need for census to be completed, because it is also available online.
Yeah, that's huge.
Okay, so which I think is a caveat to
this yes, it is
situation. The fact that I can pick up my cell phone and complete my census online, I think that's the message really I'm trying to get out there to those folks who are scared, nervous. Please.
You have to stand up and be counted.
Stand up. This is the time that you really need to be counted. This is the time that we really need to stand up and don't let what happened in Census 2000 happen again, because we have a shortage of resources from the last census because people did not report accurately.
Didn't report at all.
Exactly, or didn't report at all for that matter. So please, I urge you, if you are watching, let someone else know who's not watching this show the importance of them counting themselves in, the importance of them, to go online, use your cell phone, like I said, even if you don't know how to use a computer. But nowadays, technology is anything.
Correct.
Your cell phone is the most readily available technology that we have at our fingertips that we really need to take advantage of. Use it so we don't lose it.
Yeah. And if you're technically challenged, tap into somebody.
Get a teenager.
Yeah,
get a child, get a grandchild, get your neighbor, somebody. But I'm encouraging everyone to please go and log on to Census 2020. Once you get in there, trust me, you will get to find your way, or you will of how to get yourself counted in.
We need to be counted.
We need to be counted, because even if you don't have your papers, if you're not legally living in this country, you still need to report it. Don't be afraid, because again, this is how we get enough resources available for our communities. We depend on that, on those monies.
We do.
And budgets are allocated based on the number of residents within the districts, within the region.
Yeah.
So therefore, by not reporting yourself, by not counting yourself in, you're shortchanging yourself by doing that.
Yeah.
So
we talk about, limitations and lack of resources. It's real. It's real, and not adequately portraying who we are in numbers makes a difference. So I urge everyone, do what you can. It's online. It's not like somebody's knocking at your door. Now this is the era of Corona. People are not even opening their doors for the delivery. They're like, leave my package outside. I'll come and get it. Put it over there. Put it over there. You don't have to open your doors. It's about doing it in the privacy of your own home. Log on. Be counted. Don't listen to those theories of conspiracy. They'll know who you are and where you are. ICE will come and get you. All not based in facts. Everything moving forward is based on these numbers. So I don't know how to say how important you being counted is. It really is important.
We can't stress on it enough. So with that being said, I have to be mindful of the time as well, because our show actually lasts an hour. And it's so unfortunate that I did not get my partner online as I promised from the beginning of the show, but we're about to end the show. However, before we go, before I even say thanks to you, I'd like for you to leave our audience with some tips of how to protect themselves again during this coronavirus. Kind of recap for us about the myths and the facts that they should know to equip themselves, because knowledge is definitely power. And you and I, we're both in the education field. Our goal is to really ensure that our population is educated, so that we're not going around spreading rumors or being misinformed and misinforming others as well.
Correct. So if I could leave top 4 or 5 tips. Number 1, if you're not feeling well, don't go to school. And I'm not talking about stomach ache, because COVID doesn't cause diarrhea. It's all runny nose, fever, sore throat, that type of thing. Those are like our general flu-like symptoms, body ache, malaise. If you're not feeling well, don't go to the emergency room. Don't go to the urgent care center, because if in fact you are infected or have some virus, you will spread it to others. Instead, call your providers. Many providers, and I'm including myself in this as well, I have texted many of those who I provide care to and say, if you're having symptoms, reach out to me. Please do not go to the emergency room. That's huge. Washing your hands. I don't know how to emphasize the importance of hand washing. Wash your hands, wash it with soap and water, minimum of 20 seconds. Find a song that you like and sing the chorus 3 or 4 times. That's your 20 seconds. Dry and realize that your hands can be a carrier of microorganisms. Stay away from those who are ill. And if you yourself are ill, it's okay for you to wear a mask. For those healthcare providers who are healthcare practitioners, allied health professionals, because I'm going to include everyone here. Now, it's not just about nurses and doctors, it's about nurses aides, home health care aides, PCAs, patient care technicians, nurse technicians on the unit. If you have not had your flu vaccine, that's the only reason why you should be wearing a mask, right? And that's based on the Commissioner of Health for the state of New York. I'm not sure what they're doing at every other place, but that's the only reason you should be wearing a mask. Outside of that, don't mess with their mask, please. We need the mask for those who really need it. Ease up on the gloves. Remember putting the vinyl gloves on, driving around the city, going into the supermarket with gloves on. If there is remember, corona is contact. So the virus lives on surfaces. So you're going to touch things with your hands. If you come in contact with them, they're on your hands. So now when you walk to your car door, you're using the same gloves because you're not washing your hands. And I want to tail back, and I'm going to end it with this. I'm going to tail back to the hand washing. We use hand sanitizer when we don't have access to clean soap, clean water, and soap. Okay, that's hand sanitizer is not to replace hand washing when you can actually wash your hands. So please do us a favor. Wash your hands. I don't know how many times to say it.
Lavez men nou. Diyo kwe mwen s'il vous plaît.
Lavez men nou. 20 secondes. 20 secondes?
20 secondes.
20 secondes. Secondes. Avec savon, ak glou, séché yo bien séché. Ou pas besoin hand sanitizer sous gen glou ak savon. Ok? Ça réellement important. And I think those are my top tips. Stay out of, away from huge crowds. A place with hundreds and hundreds of people right now may not be the time. Mm-hmm. As you see, a lot of
hanging out at the club, getting your
groove on. Right now,
wrong
time. Stay home. Spend time with family, friends. Encourage people who come into your house to wash their hands, remove their shoes, that kind of stuff. Things that we already know. And really take care of yourself. And I like to end things by saying, at the end of the day, it's about health, right? And
health is wealth.
Health is wealth. And
la santé c'est richesse.
That's it. And because without health, you can do nothing. And I have to role model certain behaviors. And people are looking at you. They're looking at you. And they're watching what you do.
Of course.
So if you're putting your mask, a surgical mask on in your car and wearing gloves to go leave the house, they're going to be like, well, if Dr. Mo is doing it, I need to do it too.
OMG, speaking of that, I just recalled about a month and a half ago, I was traveling. Oh, we traveled around the same time.
Yes, we were on the same plane. Oh my God. I didn't know, but I saw a post. I'm like, oh, Mona Lisa's on this plane. I told Dan, I said, Dan, Mona's on this plane.
I was already scared back then because, listen, I'm sitting at the airport. People are coming around me.
Yeah.
I started to get scared back then. So, depuis là, ça, comme monter dans l'avion, c'est comme si m'na dou, y a dit tout le monde mette seatbelt, moi-même c'est nettoyer, c'est Clorox, même m'a sué manche. But look what happens afterwards. You cancel to flight.
Yeah. I mean, so again, they're valid. Some of the concerns are really valid, but at this time, you have to remain composed. And remember, nous gen Timon. So Timon, you have got this sanap fair too. And ça n'a pas un pile stress. Timon, you pas besoin de stress ça yo, mesdames et messieurs. You pas besoin de stress ça yo. And they're not saying anything, but they're watching everything. They're watching the news, they're listening, they're on their phones and their devices, and they're paying attention. Let us not feed into mass hysteria. Let us remain calm. We will get through this. And at the end of the day, ladies and gentlemen, be kind to one another.
Be kind to one another. That is so important. And I think you and I have been practicing this a lot. I've been ending a lot of my conversations. I used to do that with my children and my family members. I've been doing it a lot with friends. I'd say, I love you at the end of a conversation.
Anybody that you value.
Anybody that I truly value, the conversation ends with, I love you, because this could be the last I love you that you hear.
Yeah.
And I think it's about us having each other's back, us being there for each other in these times of trouble, in these times of panic and chaos, of hate. We're living in a society where, for some reason, these things are on the rise.
Yeah, they are.
And what the world really needs in these times is love.
Really love. Love is the answer.
Love is the answer.
Because I kind of always make this connection. I don't remember who I heard say it, after somebody had passed, that, eventually the fruit baskets stop coming, the flowers, I hate flowers, but the flowers stop coming, the phone calls start to get less and less. But God is always there.
Always there.
And God is love. And so by just saying God is love, whenever I say, just love one another, it's all centered around the Almighty, who is the master architect, by the way. Everything done with a purpose, a time, and a season. We're going through a really rough patch right now. Let us support one another in the Haitian American community, and not only limited to the Haitian American community. I did an interview with the Haitian Times with this gentleman, Greg. I can't remember his last name, but he called me and he did an interview. And his focus was, how is the COVID-19 affecting the Haitian American nurses? And first and foremost, I said this is not about Haitian American nurses. It's our problem collectively as a community.
It's a worldwide, it's a global
issue. So it's affecting all of us. So above all, health, kindness, and love.
Absolutely.
Health, kindness, and love.
I've never found someone like you.